a child has a life-threatening illness, he's not alone. Each and every person close to her, parents, siblings, relatives, friends, shares a piece of that illness. And while treatment takes a tremendous toll on the child, it also impacts those around him. Since 1982, Believe in Tomorrow National Children's Foundation has been helping children with life-threatening illnesses and their families through programs that bring comfort, joy, and hope into their lives. Programs that provide ongoing support from the child's diagnosis to the end of the treatment process. Our hospital housing program offers families a place to stay when a child needs them most, when they're far from home for medical treatment.
All the people on the staff of the Children's House know us, and so they talk to you as a person, and you feel more at home here than you do back at our big hospital back in Sydney.
Based on a patient priority structure that gives preference to those children and families in most urgent need, our Children's House at Johns Hopkins provides a home away from home to families from all over the world who have come to Johns Hopkins Hospital for help.
We appreciate how close in proximity it is to the hospital, how affordable it is. They just think of every aspect of a family's needs when their child is in the hospital receiving medical care.
Here they enter a community of support with volunteers, donations, and events designed to renew their physical and emotional energies.
Sometimes family members, friends at home, just have no idea whatsoever what you're going through when you're here in this kind of situation away from home, having a medical procedure done. And the other families, they understand, and it can be a completely different situation with their child, but the emotions and the feelings are the same, and that is so important, to be able to bond and support each other.
For children who need longer hospital care, the Believe in Tomorrow Children's House at St. Casimir opened recently along Baltimore's historic waterfront.
This is a tremendous effort, and we very much applaud the team of folks who put this together. You know, some guy sitting in the corner had an idea. That's how these things start, and they grow from that to what we have today.
This is the first hospital housing facility in the United States to focus exclusively on the long-term housing needs of pediatric bone marrow transplant patients and their families.
St. Casimir's is a home away from home, literally, for our families. We are taking care of their children in the hospital for anywhere from 30 to 120 days or more. The children are undergoing bone marrow transplantation, having intensive chemotherapy for leukemia and other types of cancer. This is a very intense and stressful time.
The juvenile bone marrow transplant process is very, very lengthy. It can be several months. And so the families need someplace to stay. Obviously, the expense of the procedure itself is significant, but to have to find hotel rooms and meals